bone cancers are rare. As a matter of fact, it makes up less than 1% of all cancers.
Yeah, well, the National Cancer Institute says two of the most common types are often seen in young adults. Dr. John Abraham is an orthopedic oncologist. He joins us now with information that parents should know. Welcome to the show. Thanks for being with us.
Thank you. Thanks for inviting me.
You know, this is so important to be talking about, and for parents out there who want this information and are not sure where to go. How does bone cancer come about in a person, especially a young adult?
Right. Well, like most cancers, we don't know exactly where bone cancer comes from. Bone cancer falls into a category that's called sarcoma.
Okay.
And sarcoma is all the cancers that are developed from the materials that make up your arms and legs. So that's why an orthopedic oncologist is the person who deals with it. So that includes bone, fat, muscle, nerves, those kind of things. So we can look at them kind of as two categories.
Okay.
Soft tissue and then bone. We are figuring out over time what the gene defects are that cause each of these cancers.
All right.
But there's about 100 subtypes, and so far we have maybe 20 of them or so figured out.
Wow.
And so importantly now, what are the symptoms to look out for?
Well, it's different depending on what type of cancer you're talking about. So for the bone cancers in particular, that usually comes along with pain. And so if you have an injury or something like that, that may cause pain too. So it doesn't mean every painful thing in your arm or leg should be worried about. But pain that comes out without any real trauma or anything like that, that is something we would start raising our attention to. One of the things that we see in bone is that the cancer can start eating away at the bone and make it weak. And so people may get fractures without any kind of trauma. So that's a real worrisome thing. That's called a pathologic fracture. And that is something that we really are concerned about. For soft tissue, on the other hand, those cancers usually don't have a lot of pain associated. So when I hear about something in the arms or legs that's a lump that's painful, I start thinking about things like an injury or abscess or something like that. Those are less worrisome. I mean, they have their own problems, but they're less worrisome than cancer.
You know, you look up things, you look up symptoms, and you see it, and then you get scared if you're dealing with something yourself. How does somebody tell the difference, maybe they can't, but between a sports injury and something more serious where they need to come and talk to you?
Right, and we see this problem in the office all the time. The bottom line is that sports injuries and things like that are very, very, very common. And bone cancer is very, very, very uncommon. So it's not like every pain in the arm or leg we have to worry about bone cancer. But on the other hand, if there's something happening that just doesn't make sense, then it has to be looked into further. So if you have an injury and it goes on for 2 months or 3 months and it's not getting better, and in fact it's getting worse, and now there's a lump, well, that just doesn't make sense. So that's when we start looking into it further.
And when you do go to the doctor and you have a pain, what will the doctor do to rule out cancer? What are the tests?
Right. Well, the first thing is to just, figure out if the story makes sense or not, because we really have to determine which patients need further workup and which don't. So we do a good history and a good physical exam. It's amazing how much you can pick up just with those things alone. But then when you have to go further, usually it's by way of imaging. And that imaging will be an X-ray for the bone and an MRI for the soft tissue. Unfortunately for sarcoma, we really don't have any blood tests or other types of tests that can diagnose it right off the bat. So ultimately it ends up being imaging and then maybe a biopsy if it's warranted.
All right. Dr. Abraham, thanks for stopping by and talking to us today.
It's my pleasure. Thank you for having me.
These are things that we have to have, but don't always love to, but need to have conversations about so people are aware of what's out there and what's going on.
Thank you so much.
All right. Thank you. Take care.